conduction aphasia. Conduction aphasia is a type of language disorder that affects an individual's ability to repeat the words and phrases, as well as to find the right words when speaking.
Why do sufferers get ill? Conduction aphasia is usually caused by damage in airway fascicles, a bundle of nerve fibers in the brain that connect broadcast area for speech production and workless area for language comprehension.
Why can it happen? Conduction aphasia usually occurs due to damage to the brain, which is often caused by the first stroke. This condition occurs when blood flow to the brain is disrupted, causing damage to the brain tissue. The second, head injury. Heart to the head can damage brain tissue and cause language disorders. The third is brain tumors. Abnormal cell growth in the brain can suppress or damage areas associated with language. The last is brain infection. Infection can cause inflammation and damage to brain tissue, which impact the ability to speak and understand language.
What will the sufferers gain? A patient with conduction aphasia usually experience frequent language or speech error, which is characterized by difficulty to repeat word or phrase, difficulty to find the right word or anomia, difficulty to naming. The fourth is usually say and the last is difficulty in word order. For instance, when sufferers with conduction aphasia asked to say or repeat word or sentence like "I want an apple," the sufferers will say "want apple," like this. Or the other example, you can see the following picture, that is someone with a patient conduction aphasia want to water by saying please water to other people to take water, but he said please like this. Or you can see the real conduction aphasia suffers from the following videos like this.
The producer asked us to count to 10. Remember that?
Yes.
Can you do that again?
Why? 1, 2, 3, 4, 5, 7. Going to Gabby people. Go. I can't.
No, that's really hard. Let me get you started.
I was stunned.
Okay. 1,
2, 4, 5, 6. Better send. Point.
Good enough. Let's.
Is that all right?
That's fine.
You say no.
No.
If. And. Or. But.
But.
Okay, I'm gonna put it all together. No, if, and, or but.
What should some activities be avoided? Well, some limitations that individuals should do. 1. Avoid talking too much, because talking too much can worsen the symptoms. 2. Avoid complex conversation. because it can make difficulty for them to understand or express themselves. 3. Avoid using difficult words. 4. Avoid overwhelming situations like meetings or gatherings. And last, avoid speaking too quickly because speaking too fast can make it difficult for sufferers to express themselves. How to treat the ill? There are 5 treatments to improve speech and language therapy. Number 1 is speech therapy. Work with a speech therapist to improve communication skills. And number 2 is repetition exercise. Repeat words and sentences to improve language ability. For example, eat, drink, and sleep. And short sentences like I want to eat. And number 3 is word finding strategies. Use description or association to help remember words. For example, red fruit for apple and the others. And number 4 is alternative communication methods. Use writing or pictures to aid communication. And the last is cognitive training. Engage in activities to improve attention and memory.